Hello there. Today we'll be talking as promised about gestational diabetes. Welcome to your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Yide. If you're not yet subscribed to this channel, I know you're missing out. Why don't you do that right now and hit that notification bell so that you get notifications every time I post new videos. It's been watching a while. Now straight to the chase. Gestational diabetes. What is gestational diabetes? Gestational diabetes can be defined as glucose intolerance of variable degree with onset or first recognition during pregnancy. Like I said earlier, this is usually found in women who are previously not diabetic, but it seems that the pregnancy is the one inducing the diabetes. Now, what are the signs and symptoms? The signs and symptoms of gestational diabetes are not straightforward. Some pregnant women will never come down with noticeable signs and symptoms. Like we said the last week, there are three major signs: that's polydipsia, polyphagia, and polyuria. Polydipsia being drinking a lot of water due to extreme thirst. Polyphagia is eating a lot of food, eating excessively, while polyuria is excessive urination. These symptoms might be present or not. There are risk factors to gestational diabetes, and the very first one is a familial predilection, a genetic predisposition, so to speak. If your mother or any of your older siblings have gestational diabetes, there's a high tendency that you might come down with gestational diabetes. Number two is elevated BMI, and BMI stands for body mass index. Still talking about obesity. The more you weigh, the higher the tendency of gestational diabetes. Now, number three, certain ethnicities like Africans, Hispanics, Black Americans, Asian Americans, and American Indians. Number four, age. It has been discovered that the older one gets, the higher the tendency or the higher the risk of developing gestational diabetes. Number five, sedentary lifestyle. That is extreme inactivity. You actually do nothing during this pregnancy. You have everybody around you do everything for you. It's advisable that you get active. Too much inactivity can actually predispose you to gestational diabetes, amongst other things. Number six, being pre-diabetic. You stand a higher chance of gestational diabetes if you're already tending towards diabetes. Number seven, having had gestational diabetes in previous pregnancies still increases your chances of yet another episode of gestational diabetes. Number eight, having polycystic ovarian syndrome, what's commonly known as PCOS, increases your risk of gestational diabetes. Number nine, and the very last point I have here, is having babies previously with the weight 4 kg and above. We call these kind of babies macrosomic babies. So when you have an history of having very, very large babies, you stand a higher risk of developing gestational diabetes. Now, what's the cause of gestational diabetes? Really, there's no specific cause, just risk factors like earlier mentioned. Now, complications of gestational diabetes. May I add this, that with gestational diabetes, you stand 2 times the risk of birth injuries, that is injuries during delivery due to giving birth to a very large baby. You also stand times 3 the risk of having a cesarean section, and you also stand 4 times the risk of having your baby admitted into the neonatal ICU. These things are very likely. Now to the complications specifically, talking about risks that can affect your baby. The higher risk of premature deliveries, fetal macrosomia, that's very large babies, babies weighing 4 kg and above, serious respiratory problems, hypoglycemia immediately after birth. Hypoglycemia means very low blood glucose. Due to the extreme size of these babies, they have a very high metabolism and thus they need more food. So when they come out really hungry. Now the terms of obesity and type 2 diabetes later in future. Now I'm talking about the baby itself. The baby itself has the higher risk of obesity and type 2 diabetes later in life. And lastly on my list there, stand a high risk of unexplained fetal demise, fetal death, what we call stillbirth. Now over to the complications that might affect the mother. The very first one is a higher risk of preeclampsia. Now preeclampsia is pregnancy-induced hypertension with edema and proteinuria. Edema is when you have swellings probably on both feet, the abdomen, on the face, anywhere, even the abdomen, and finding a large amount of protein in your urine. This can be done during your antenatal visits. Also, the mother stands a higher chance of developing type 2 diabetes in the future. Now, treatment and management. I would say there is no one good fits all treatment. If diagnosed with gestational diabetes, your doctor will let you know the best mode of treatment. Some might require drugs, some might not. Some might just need to adjust their lifestyle to what you eat, watching what you eat, ensuring that you eat healthy and exercising regularly. How can gestational diabetes be prevented? If you have a family history or you're predisposed to any of these risk factors mentioned, a healthy diet and regular exercise can do you just fine. Ensure that you stay within the limits of a balanced diet. If you just love this video, I would have you like, post a comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.